on.
I'm going to switch on the webcam, but probably switch it off a bit later so that obviously the sound and obviously the communication is quite clear. Now, just very briefly, just to recap, what I'm going to do is you were inquiring about the assignment and the assignment structure.
Yeah.
So let's look at briefly the assignment and the assignment. What I'm going to try and show you is maybe an assignment brief for this unit, and then I'll show you a sample assignment that you can look at. So 4.16. Right, so just to magnify this. So that's the assignment brief, okay, which obviously comes to us from the awarding organization. So obviously assignments are set in this case by ATHE. In the case of Edexcel, when you've done your level 3, you must have noticed that the college that you're doing the assignment from, the course from, actually writes the assignment, and Edexcel then approves it. But what happens in the case of ATHE is they give us the assignments, which obviously we then use, and obviously all the learners actually attempt the same assignment. Is that okay? Yeah.
You have to put the ATHE logo at the top.
No, you don't need to put that ATHE logo, no. I'm just going to quickly now open one of the assignments which would have actually passed, and the student would have submitted that to us a bit earlier. So that I'm just trying to see if I can pull out the same unit, from one of our from previous visits. I think it might be a bit difficult, but yeah, let's see. So I've got level 5 as of now, but I'll just go with one of them, just to show you. I think there is one which you will also be covering, which is, I think, so in the units that we are looking is, so your finance for, managers, for example. So what I'm going to do is just to explain very briefly, minimize that, and okay, there are 2 ways of looking at doing the assignment. Okay, now in the case of ATHE, what they kind of look at is the assignment brief, as you can see on the right hand side, or in your case it will be the left hand side, is actually provided by the awarding organization. It says a sample assignment, but that's the actual assignment that actually you need to attempt. Now, what they do in the assignment is they give you a bit of a scenario or a context to, kind of lay in a bit of foundation so that when you're attempting the tasks, you actually keep the context of the scenario in mind while you're attempting it.
Okay.
So in this case, for example, the communications unit, what it is giving you a scenario of is there is a care agency called ATHE Home Services, which has a number of staff, and they take care of a number of operations for giving services in health and social care. Now, this particular company is undergoing some sort of a restructuring, as you can see here briefly. And what they are looking at doing is they're actually looking at laying off a number of staff. That means they've been asked, the company is downsizing essentially. So what they're asking you to do is basically look at achieving an efficiency of 25% reduced budget from the overall 125,000, just to give you a scenario. And as an operations manager, so when you're attempting the assignment and the tasks, the task you assume is that you are the operations manager for ATHE Home Services, and considering these changes which the board wants you to implement, they will ask you to attempt these tasks. Right?
Yeah.
Now, in the case of Edexcel, it's pretty much the same. When you've done level 3, you must have had an assignment brief for each unit. They would have given you a learning outcome, and the learning outcome will have a context in terms of what you have to look at, and then basis that you have to answer 2 or 3 questions. So here, the tasks are basically your, the assignment tasks, which are equal to your questions. You may call them as questions. And what they do is the scenario is basically the context which has been given. And what we have to do is when we start doing the assignment, so you're looking at task. This particular task that you see as bullet points is actually from learning outcome 1. If I minimize this for a second, is basically from learning outcome 1, which is here, and it is starting with task 1.2. So this first task that you see is actually 1.2 here. So it says access different modes of communication you could use for an alpha home service. And if you see here, it says access appropriate use of different modes of communication for different purposes. Do you see this? So this is more or less correct. Now, there are 2 ways of attempting the assignment. And the way I would suggest you to do is go by the assignment brief, which is this document on the left. Now, sometimes we do see some students and learners actually find it easy to attempt the assignment from here, which are these tasks, which I'm just kind of shading. Okay? The reason why they find it easier is because if you see the specification sheet, each of these tasks actually tells you, when you look at the indicative content, you exactly know what you're trying to attempt in that task. So this is task LO1, learning outcome 1, which is highlighted. Right? Within the learning outcome 1, there are 2 tasks that you have to do. So when you go to the indicative content, you kind of see that you're able to make out that this is all the bullets, para 1 is essentially for task 1.1, and this is essentially task 1.2. Now, if I go to learning outcome 2, you will see there are 5 tasks. So what the indicative content is all 5 paragraphs. So you clearly know this is task 2.1, this is task 2.2, then clarity of impact of technologies 4, and conventions into technologies 5. So when I'm doing the assignments, if I'm the learner, I'm doing the assignment, what I would primarily do is, if I come to sample assignment that I'm going to show you, just one as an example, what we tend to do is, so you write task 1, okay? And then you basically find this task and you write it as it is from the assignment brief, which is this. You write it here. And then comes in the report format. Now, what this bit basically consists of, the one which I'm trying to now highlight, is actually coming in from the indicative content of the unit. Are you able to follow that?
Yeah.
So this particular learner, for example, has attempted, let me, for the sake of ease, are you comfortable with this, or I'm just going to try and pull out maybe the assignment brief for 4.9, so that you can actually correlate the tasks as well. 4.9. 4.9, sorry. There you go. So that's 4.9, that task, that assignment brief. And basically, if I look at the first task which has been done, purpose and requirements of keeping financial records, it says explain the purpose and business organization meeting financial records. Do you see that? Is that visible at your end?
No.
Okay.
I lost track of what you were saying.
Okay. Well, just to show you a just to correspond and correlate the same assignment that I'm showing you how to do it, and maybe format it or structure it, I've opened the same assignment brief. So this assignment, which I've kind of pulled out, is basically nothing but finance for managers.
Okay.
So what I've done is I've opened up the assignment brief for finance for managers. This is one of the units that you will also be doing. And again, there's a scenario here, and how the student has started to attempt and structure the assignment is that they put the task, and they put the first task there, which is purpose and requirement of keeping financial records, which is highlighted here. And this correlates to task 1.1, as you can see.
Yeah.
Right? So the assignment in this particular case, you'll go but task by task. So you'll look at this one. The second one is analyze techniques for manual and recording accounting transactions, and here. And then the third one, the next task is legal requirements of financial reporting, which is analyze legal requirements of financial reporting. So basically, you're taking each of the tasks, putting it into the report, and then obviously going by answering that question. So question, answer, question, answer, question, answer.
Yeah, I understand.
Is that okay? Now, in the assignment, this is essentially a report format. So obviously, what the learner has done is they put the task as a headline here before they start answering the task itself. And then you start looking at, maybe what is the difference between management and financial accounting. So the first thing what we'll do is we'll define management accounting and define financial accounting. And then ask you to compare. If I go to this one, compare. So explain the differences between financial and management accounting. So what the learner has done is define the accounting and then take an example of why these are used in different scenarios. And this bit, which has been covered here, as you can see on the this bit, which is this bit here. This bit is actually coming in from the indicative content of this particular unit. So if I have to pull out 4.9, this was activity 4. And it talks about costing methods. So there you go, which is, the evaluation of costing methods, which is, in this particular task. So if I have to look at this, management and financial accounting. So it gives you a clear idea in terms of where and what content you have to actually cover in, the assignment. This is just an indicative guideline. Is that okay?
Yeah, that's okay.
Are you there?
Yeah, I'm here.
Okay, so kind of doesn't give me a convincing reply that it is helping you. Is it helping you? Are you able to follow?
Yes, I understand.
Okay. And what you're essentially looking at doing is, because this is a financial unit that I've picked up an example of, you will not find much referencing in it, because in most cases you're looking at working with formulas or calculations in this context, right? Wherever you have put in theory, or for example definitions, or explained a concept, there you are looking at actually putting some theory in. But all these tables and everything are actually coming in from the assignment brief. There's nothing which is actually coming, all these things. If you see requirements of the activity, these are all tables which are coming in from the assignment brief, and what you're looking at doing is doing some calculations of finding out, for example, the annual rate of return, which is ARR, or the payback ratio and things like that, which are required in this, assignment. So there's, as you can see, there's very little, theoretical concepts involved, apart from the first few tasks that you are, looking at doing. Most of it is calculations in the, learning outcomes 2, 3, and 4. There is some theory which you will look at is primarily sources of finance and things like that. So, and then towards the end, what you do is, I don't see much reference which has been done in text here, as you can see from the assignment. So we see one referencing here in particular, and not much because of reasons of, obviously I'm just scrolling it quite quickly, it might just flutter on your screen. But as you can see, there's not much references. So what the student has done towards the end is, has actually compiled of, referencing here, the account, Hopes and Parker. As you can see, more of a theoretical task, purpose and requirement of keeping financial records. And this then has been compiled in the form of some sort of a bibliography towards the end by the student. So that's understandable in terms of this particular assignment, if you ask me.
Yeah.
Sorry, I've lost it somewhere, but he's probably put some references in. it's not particularly a good example, because I think the student has done a lot of resubmissions of the tasks, because when we were looking through the tasks, some of the tasks were very briefly covered, as you can see. So, he's done some references here we can see that have been covered, in the initial part of the assignment. But typically, in a good assignment, what we will look at is minimum of 6 references, which are academic references, minimum 6. You can have a lot of online or website references as well. That is not a problem. But minimum of 6 references is something which we kind of, ask the students to look into when they are doing the assignment. So this assignment is pretty much a report format, as you can see. And what we do is, when the assignment is submitted to us, one of the assessors will actually mark the assignment as well. So, that is what you'll get to see on the marking of the assignment as well. Is that okay?
Yeah.
What I'll very briefly show you is another assignment which has. Sorry? Hello?
Oh, sorry.
Okay. So maybe I'll show you a different assignment which primarily also has the element of presentation in it. So in ATHE, I think the way we are delivering the course, we are kind of going to stick to 2 modes of assessment. One will be obviously a written report or a written assignment, and the other predominantly is going to be something which is what I would say is a presentation, which will be part of the unit. So in some of the units, I think, just very briefly looking at the units that you're doing, I'm not too sure. I think managing this bit, which is the communication unit, might have a presentation element. And how you will come to know when you look at the assignment brief, when you download the assignment brief from the learning platform, which is here. If you scroll down, you will see in the guidelines there is something called guideline for assessors, actually meant for us. But students find this useful is because what it tells you is, when you look at the tasks here, it tells you what suggested evidence the assessor will actually look for when you submit the piece of work. Is that okay? So in this case, I'm looking for a word. If I have anything which the awarding body is specified that the needs to do a presentation. So like we have done LO2 and LO3, review should be comprehensive evaluations about communication methods, skills. So basically, this is a word, kind of you're more or less producing the word report. To the best of my knowledge, from what I can see right now, is I don't think there is any unit. I'll double check, but I don't think there's any particular unit that will require to look at maybe a presentation. So most of them are, I think, going to be word reports or word assignments. Is that okay?
Yeah.
I'm just going to try and briefly show you. I can pull out something. Give me 1 second. So 5.5, just to give you an example, this is a unit which is managing communication at level 5, similar to the unit that we are doing, which is communication in health and social care. So the difference is the context. But in this particular unit, as you will see, that we will also have an element of one of the tasks or activity 1, for example, in this case here, as you can see, is actually required to be done as a presentation.
Yeah.
Right? So the learner will basically make a presentation which will be observed by one of our assessors. Say if you were looking at making the presentation, what I will do is I will pass you the presenter control. So you'll have a full control on the mouse, and obviously you will run the session like I'm running it now. You'll be able to run it from your side. And what we will do is, as you're presenting slides, we'll be making some observation notes which will look at whether you have achieved the activity or not. So maybe what I will look at is look through your assignment briefs to see if one of the, if any of these assignment briefs have, a different mode of assessment, which is a presentation. But I think in most cases, it's primarily going to be a word assignment, as you see here. Okay?
Okay.
So any questions that you have, has this been helpful? Have you got any questions on understanding the structure of the assignment, or how you would look at maybe attempting when you start attempting the draft assignments? So do you have any questions at this moment on this particular thing, the structuring of the assignment? Yeah, I'm asking you, sorry, if you have any, do you have any questions, or is this, is it clear enough?
Yeah.
So any questions on this?
No. Any questions?
Okay. That's okay. Brilliant. What I'm going to also quickly show you one other thing, just to give you a perspective. When you do send us assignments, I think I'm not too sure if I showed this, shared this with you in the previous induction session. But when you send us a Word assignment, what we are going to be looking at doing is, I'm going to be trying, the assessors will essentially give you feedback by looking at Word review. So, for example, if the task meets the criteria, this is absolutely fine. As you can see, this particular task, you don't need to do anything in this. This is meeting the criteria of ATHE. But in some tasks, if you do feel that there are things which are missing, or there are things which have been which have been missed out, then we will give you a direct feedback to try and include things. So that will be something which will be a formative feedback to you to try and work in those areas to include that in the task so that it meets the criteria. Is that okay? Are you able to see this clearly? Hello? Are you still there? Hello? Yeah, so sorry, what I was trying to show you is, have you been able to understand this?
Yeah.
So we'll try and give you some feedback, which will be more or less directive, and it can be coming across to you in the Word document, so that before the final assessment, you will have the opportunity to be able to, look at feedback so that you are able to improve the assignment for submission. Okay. I'm going to try and close this document now. And we'll go back to something that we were looking at, obviously going through today. So just going back to, so if you recall, we had done, the role of technology in communication in the last session, which is what we had covered, which was learning outcome 2, which was here. Correct? I think I'm losing you. I'm losing you today.
Yeah, I can't even hear you. You keep breaking up.
Oh, right. Okay. Give me 1 second. Let me try and. Right. Is it better? Are you able to hear me better now?
Yeah.
Right. Okay. I'll try to put on a. I think it should make a bit of difference. Are you there? Are you there?
I'm here.
Right. Okay. So if you recall in the last session, when we basically looked at covering the role of IT, or information technology in communication. So what I'm looking at doing today is, look at the learning outcome 3, which is understand the key features which are required by health and social care professionals, for communication. And these will basically look at covering tasks 1 to task 3.4. Is that okay?
Yeah.
Now, I've got a handout here, which I'm going to email to you in any case after the conversation, but just to very briefly go through. If you recall the presentation that we had covered, the communication cycle actually consists of 3 main elements. So we have somebody who's there, then we have somebody, we have the message in the middle, and then we have the receiver. And sometimes when the receiver asks a question or raises a concern, that is passed on as feedback to the speaker or the originator of the message. And that was nothing but the communication cycle, which is reflected here that you see.
Is that Argyle?
Got it? Should I make it a bit bigger? Is it better now? Is it visible?
Yeah, the cycle. I think one like that this other person created, Argyle's communication cycle.
Yeah. So just because this particular chapter or the learning we're covering, actually we'll hover over one or two learning outcomes. So this particular handout will cover some of the things that we've discussed before. And I'm just going to refresh as we go along to try and cover that up. So that was the communication cycle that we covered in the first session. After that, when you look at, specific issues or, how do it specifically in the health and social care context, if I look at the example of a surgery, for example, when you visit a surgery, when you visit your local surgery, what you are basically visiting the local surgery is because you want to be able to either you're not well or you need some medication or you're picking up, say, repeat medication, something like that. Now, the kind of communication which happens between you and the registered nurse there or you and the doctor falls within the remit of having communication within the health and social care context. Now, most of the communication that you do, how do you start a conversation? Either you make say a sentence, or you ask a question, and the other person on the other side will listen to you, and at some stage will either respond back in the form of an answer, or will respond back to you from a point of view of answering the question that you've asked. So you imagine yourself, you've gone into the surgery and you've said, okay, I need an appointment with a doctor. The person at the reception will actually look at the appointments diary, and what he or she will do is essentially say, okay, when do you want the appointment? You have that conversation, you say, okay, I'm comfortable, can I get something on Tuesday at 3:30? And she will check the diary and she'll say, okay, yes, you can make that appointment at 3:30. She gives you a slip, which is a confirmation of the appointment, and then you go away. This form of communication, which typically happens at the surgery, would kind of fall in the remit of being verbal communication. You're speaking to the person directly, and the person is able to respond by answering your questions, and this then becomes something called verbal communication. Now, when we look at non-verbal communication, these are things that we have covered in the past, but going to refreshing some of these things in order to cover the learning outcome 3. So in non-verbal communication, what you do is you do communication through different mediums, and in some cases this involves use of body language. This also involves use of expressions or gestures, and in some cases you might also touch the other person on the other side. That means if you're looking at meeting somebody and you might end up shaking the hand of the person, and that would involve touch or a contact with the person while you're having the non-verbal form of communication. You might not say anything, you might nod your head and then shake the hands, which would mean that you've kind of made a greeting and the other person has also responded, and you have ended up touching the person by shaking the hand. So these constitute things like non-verbal communication. Sometimes you're watching the TV and somebody walks in, you look at that person, and if he or she switches on the light, you're watching a movie, it creates a bit of a disturbance. You look at that person and say, and you raise your hand, what are you doing? But you're not actually saying something. So you're communicating through non-verbal means, using either gestures or facial expressions, which the other person is able to recognize. So far with me?
Yes.
Okay. Now, one of the form of non-verbal communication typically also happens if you look at BBC Breakfast in the morning, you look at the use of sign language. And that is primarily, somebody converts the presenter's speech into sign language for people who are not able to hear but are able to understand sign language and symbols, which they use to decipher what is being spoken about or what the conversation is all about at that stage. So when you visit a bank or when you visit a surgery, you sometimes do find there is an induction loop for people, those who, for example, hear a bit louder. So in those cases, you have the aid of technology coming in, wherein induction loops are installed rather, and that induction loop helps to amplify sound because you're talking to a person on, and there is a barrier or there is some sort of a physical partition between you and the speaker. So in those cases, sometimes you end up using sign language, or you have aid of technology coming to your aid for you to be having an effective communication. That brings us to the next point, which is technological aids. Sometimes you've also seen that if I speak English and you speak something else in terms of using another language, you might have to bring in a person in the middle who can interpret or maybe translate what you're trying to say into a language which the other person understands. And the most common example that you get to see of this is when you see a mother with a baby, or you see a small child and the parents actually translating or interpreting what the child is trying to say. So you have sort of an interpretation which happens, which is with the use of the parents in the case of child. But in the case of technology, you might have an hearing loop, or if you put some sort of a hearing aid or sign language, these are then technological aids that you end up using in order to have an effective communication. The other usages of communication that we use, we have communicated with technology. The most common form would be text messaging today. It'll also be WhatsApp that people use, FaceTime, a tweet that they make, and this is all some form of communication which is happening using today the latest technology. Now, the other thing, we also sometimes, I've given you an example of this before, just very briefly. Sometimes when you go into a hospital or when you go into a health and social care context, in terms of environment, a care home or a clinic or a surgery, sometimes you get to see signs, and those signs actually communicate a lot of things without having to do any form of verbal communication. So if you see something which says something like this, wherein it says no use of phone, you clearly know that obviously use a mobile phone or any sort of device which actually makes a sound or has a frequency is not allowed to be used within this room or the environment. So those are things which we look at when we look at alternative communication, and these things also help you in aiding when you're trying to communicate non-verbally or with other types of communication methods. I won't go into this one-to-one communication, the context of listening, because as you know, a conversation involves speaking, listening, it also involves interpreting, and it also involves understanding and then a feedback. So that's a 5-stage process, and sometimes you have to communicate in a certain fashion or in a certain tone of voice because you want the message to be perceived as an important message, or convey, for example, in this case, what they've said is convey empathy or condolences, for example, in a case when you're trying to break the news, which is unfortunate for that patient or for the person. So there are various ways in which you have these conversations, and in the health and social care context, what we're looking at doing is when you have conversations. This is what is important that is directly related to LO3 that we are going to be looking at which is when you have conversation in groups. So people within different groups can have different types of communication, and it depends on the situation in which you are. So sometimes when you go to the surgery, you're having a conversation in the context that you're visiting a doctor or seeing a doctor, and those conversations are more related to maybe your medical history or the illness that you have. The same conversation in a group can be in a different context if you visit, for example, a school, and you might have a conversation with the teacher, and as a parent, when you have that conversation takes a very different context in terms of having it to understand the progress of your child in the class, or how the child is performing and things like that. some of these conversations which we have within the health and social care context are conversations when you look at, for example, the first bullet point, which is a report or a handover meeting when it is discussed between individuals. So you look at somebody who's had an operation, has come out from the theatre, the doctors have done the operation, it's been successful, and the person is then being transferred from the operation theatre or OT to the intensive care unit. So there's a handover which happens, and that handover involves maybe 2 or 3 different forms of communication. The first is verbal. The doctor might give some sort of a brief history in terms of this has happened, that has happened, and everything has gone through. They hand over some written notes in terms of the patient's requirements, which could be like, this medicine has to be given, or this drip has to be installed, or something like that. And the third would be the conversation, which is primarily happening from a context of the care which is required for the patient once he's transferred from the OT to the care unit. So sometimes these conversations involve something called handover. That means they will hand over once they finish their bit of job to somebody else. And the handover is important is because they want to make sure that everything is being captured which is required for patient recovery or patient care. These handovers do happen when you look at discharge meetings. That means the patient is discharged, you've recovered fully. They might give you some basic things which are written in a written format. That would be that this medication is to be continued for so many days. These are the precautions you need to take. There are some cases, if you've had a disability or you've had a fracture or things like that, they might recommend you to join some activity back and see a physiotherapist for therapeutic use. That means you're going to be looking at getting taking on some classes for some exercises to enable movement of the bone, or something like that if you had a fracture. And in some cases, you also have meetings with the relatives and the key care person within the organization, because something quite serious and the patient needs maybe some additional care. So the manager in the organization or the doctor will essentially end up having a conversation with the relatives or the close family members, and that would involve having a conversation to give them reassurance and to ensure that the patient is taken care of in the post-operation, postnatal care, something like that. Is that clear?
Yeah.
Okay. Now, when we look at the context of health and social care, there is one very important context comes in, which is getting involved in conversations, is that in most cases, when you look at other professions as against the medical profession, you have touch as the most important aspects of having communication. So whether it's verbal, whether it's non-verbal, it's written, there is an element of touch involved, and that is because of the sector in which when you work, you have to reassure patient, you have to reassure your colleagues, and that typically tends to happen quite often. So that is an important element. You have either verbal communications or you have communications in group. When you have meetings and things like that, you normally end up reassuring the person when you touch them, or you pat on the shoulder, or obviously have that in the group. Now, having looked at the types of communication and how they are done with of health and social care to a certain extent, we need to understand what are the barriers of communication, and this is something that we covered previously in learning outcome 1, when we looked at the appropriate channel of communication, and we also looked at what are the barriers. Now, this has been summarized in this particular chart. Sometimes we look at barriers which are barriers because of technology. There could be barriers which are barriers with regards to the person speaking a different language or having a disability. But in the case of health and social care context, I think what is important would be to look at these barriers when these are barriers in the context of this field. So disability, cultural differences, health problems, emotional distress, and in some cases jargons or signs which are used within the context of the hospitals and the National Health Service, you will find that these then sometimes become barriers because the patients are not able to understand, maybe having a look at the image, then what does this image imply? So if I just go back very briefly here to this image, sometimes I won't understand, I can understand this means no smoking. I can understand this means no mobile, but I don't understand this symbol. That means it could be no pets for all I know, but it could be something else. Here it says no walking. That's what I can decipher, but it might be something else. So in those cases, when you look at, these kind of, symbols within the health and social care context, or when you look at within the hospital, for example, sometimes these images or wordings which have been used can also become barriers. Is that okay?
Yeah, that's fine.
Okay. Now, going forward, some of these barriers are explained in a bit more detail, and I think some of them are self-explanatory. So when you look at foreign language, cultural differences, if you have a female, for example, if you have a lady or a girl which is going to see a male patient, male doctor, in some cultures, what tends to happen is the husband might want to accompany when she's being looked at, or is having a conversation with the doctor. In some cases, language could be there. That means the person might not be able to understand or speak English quite well, or maybe the language quite well, and in that case, a person might help out, to kind of, I would say translate if the language becomes a barrier. Sometimes, the dialect of the language. So if you look at the Glaswegian accent, people who are Scottish, they use certain type of words, and their dialect is slightly different. When you look at Liverpool in particular, again, sometimes when you look at the Welsh accent, the dialect is quite different, and that could also be a barrier considered, from a point of view of understanding when people speak English. We all of us speak English, but some of us have very different accent or a different dialect, and kind of looks at maybe creating a barrier sometimes when you're not that fluent in that language. Now, distress and emotional difficulties also be a barrier. If you can think of things like if you're under stress, or you've had a bad news, or maybe you've already had a news, and that then kind of becomes a barrier because you are already, stressed out, or maybe in a situation thinking of something else, and you're leading up to this particular activity. And those kind of things can also look at creating difficulties, wherein in some cases it could be extreme, that the person can have a heart stroke or heart attack. You can be depressed for a prolonged period. It could lead to mental problems, or when people have mental health problems, those are kind of emotional difficulties or barriers that you also encounter when you're dealing with patients, or dealing with customers within the health and social care context. Have you sometimes seen, if you visited the surgery or the hospital, that there are nurses, or sometimes the doctor or the practice managers will end up having a personalized conversation with the patient to try and console them, give them a bit of empathy, and also look at understanding their problems to kind of help them de-stress at times. Have you seen that? Yeah. So those are, when I look at barriers in communication in a normal context, in a business context, they are different. And in some cases, when I look at those barriers in the health and social care context, they are slightly different, because you're dealing with patients, and they might come across with, some conditions in some cases, and those then become barriers for effective communication. Some of these are explained here. Environmental problems could also be a barrier. The patient, say for example, has a chronic illness, and say for example suffers from, say, severe headaches or migraine. Sometimes they can't sustain or stay long in places where there is noise, which can act as a barrier. So they tend to stay away from noisy environments. You will see in hospitals that when you go to the ICUs or certain ward or certain areas within the hospital, they clearly put up a sign saying that you're not supposed to have conversations here, or noise as in general is a barrier, as is not allowed in those places, because you are dealing with sensitive patients, or in this case, you're dealing with patients who are under intensive care. So noise then tends to become a barrier. Sometimes you see that if you're having a training, right, and you're having that training externally within an organization, or a hall, or maybe the trainer would essentially, before he or she starts the training, would kind of tell you that, okay, for health and safety reasons, I need to tell you there are no fire drills in in practice today, or will be conducted today. And if you do see a fire alarm, or hear a fire alarm rather, what you'll have to do is you'll have to quickly make your way down through the staircase, not use the lift and things like that. Now, if there were no fire drills planned and suddenly the fire alarm goes off, it does create a noise, and somebody rushes into the room and says, okay, that's gone off accidentally, please do continue. But it kind of breaks the rhythm of the trainer and the participants in the training, and that is nothing but an example of something called noise, which can become a barrier when the person is looking at delivering training, isn't it? Hello?
Yeah, I'm here.
Okay, that's my problem.
When you talk about environmental problems in your assignment, could you talk about in care homes, like when the TVs are too loud and you can hear the noise from people's bedrooms? Or is it to do with hello?
I look at the example, looking at maybe as a prior of disturbing patients who are trying to rest. Little barrier. Like mental barrier, because electricity, then you primarily are maybe feeling cold. If there's no electricity, you might probably feel that there is say for example no lighting in the room in which you are. So those then tend to be environmental problems which are beyond your control. Things like loss of electricity, loss of heating, for example, no hot water in some cases. If you're having a bath or you're being assisted by a nurse, then if you kind of not have access to something which is coming to you from outside, then, or outside meaning physical environment, that would in that case constitute something which is like an environmental problem. Another example would be bins. Your rubbish bins, if they're not collected on a weekly basis, then it kind of tends to create something which is an environmental problem because of the menace of, for example, it could be the odor in the air, it could be leading to a bit of loitering, with the pets and cats and things like that, lead to infestation. Those are environmental problems.
Okay.
Is that okay?
Yeah.
So, as it says here, environmental problem causes you discomfort. So loss of electricity, if it's too cold or too hot, then this causes you discomfort. Environmental problem, as you rightly said, for example, if somebody's trying to have a conversation and the TV is too loud, then it leads to a lack of privacy. Because the TV is too loud and you're trying to have a civilized conversation in the other room, then it could be classified as, an environmental problem. Depends on how you look at it and in which context you look at it. Is that okay?
Yeah, that's okay. Okay.
Now, the next section that we were supposed to look at is basically something called overcoming barriers to communication. Now, now that we know.
Do you have to include every subheading that you speak about, like environmental factors? You have to talk about barriers to overcome every problem.
Yes, that is correct. That is absolutely correct, yes. So here, come again, sorry.
No, just solutions on how to overcome, like a couple of solutions for each.
Yes, spot on. Yes, spot on. You're spot on that. So obviously, after looking at the routes of communication, verbal, non-verbal, gesture-based, communications, we looked at how to have effective communication, and now you're looking at barriers. And after that, we are looking at barriers. If there are barriers in communication, how do you overcome barriers. So some of these, few pages will talk about basic things like, how do you adapt to the environment? Say, for example, in this case, it is talking about making changes to the physical environment can actually improve communication. And physical changes would mean you replace or enable, good lighting. That means if the room is battery lit, you might install better lighting in the room. Obviously that would make, communication better because you'll be able to see the person face to face, and maybe that will kind of lift the mood when you're having conversations with colleagues or, patients in particular. Soundproofing, again, is an example wherein when you look at studios in particular, or in hospitals in particular, when you look at areas wherein you go and have, say, for example, specific treatments, like if you're going in for an X-ray or if you're going in for a particular testing, you will find that there is soundproofing in the room, is because they want all sorts of possible physical barriers to be, minimized while the tests are happening. So sometimes you do see, as I mentioned to you earlier, fitting electronic devices like induction loops will also look at helping you to adapt better in the environment, so that if you're in the bank, there are 20, 30 customers, everybody's having small conversations, and when you're speaking to the teller or you're speaking to the person, you have to speak quite loud to be able to be heard properly. In those cases, they try and install induction loops which help you in adapting to the environment. Similarly, sometimes when you're looking at language as a barrier, you will see that a lot of signs in locations are always put up in, multiple languages or maybe different languages, so that they are able to appeal to a lot of people who see language as a barrier, which they can look at. Maybe you look at, say, Arabic, for example, you look at Urdu, for example, you look at English, or you look at, say, Polish, for example, and sometimes some of these signs in places wherein important information needs to be displayed is actually done in different languages. And this is to do so because sometimes when you look at the signs, you're able to understand, and you do not need an interpreter or somebody to kind of change or communicate that in your language that you speak fluently, because you're able to see that in your own language. Sorry. So you're able to see that in your own language on the wall or on the notice board, because it's been put across in different languages. So here it explains this particular picture, or the chart actually explains how you can reduce barriers in communication. So sometimes you look at reducing noise. Sometimes you have to speak slowly and clearly so that the other person which is called adapting to the pace at which the learner is able to understand you. Sometimes you display signs, clear signs, you improve lighting, you install induction loops, and in some cases you have to involve interpreters or people who are able to translate that in a different language, or maybe explain that through sign language to the person who is not able to hear, has a hearing problem. Now, going forward, effective communications, we looked at the 7 C's of communication which are important, and those 7 C's, apart from those 7 C's, in the health and social care context, I think one of the key things that we have to look at is we have to use empathy on the use of empathy or gestures and touch in particular to communicate certain type of news or breaking of the news has to be done, and that involves looking at making use of certain techniques which help and communicate that kind of gesture to the patient or the other person that you're having a conversation with. And in those cases, what we look at is let's put it this way, the importance of use of facial expressions, eye contact, empathy, the tone of voice, and the pace and the content of your speech. The careful selection of the words that you speak actually becomes very important. Now, it might not matter much when you have that conversation in the business context or in a different context, but within the health and social care context, it becomes very important is because sometimes you will see the doctor, you'll see the nurse, and she will communicate more to you through the eye expressions or through the eye contact rather than speaking to you verbally. So that is where I think there are different ways in which you can communicate effectively within the health and social care context. When you look at some of these, enablements like facial expression, non-verbal communication, eye contact, empathy, and even your tone of voice, and at the pace which you speak when you're speaking to somebody to disclose maybe an information or a piece of news. Body language is very important, and that is where when you look at the use of these non-facial expressions, you're actually using body language to be able to communicate effectively as well. There is a particular jargon that you have to pick up, which is called the solar behaviors, which is highlighted in this figure here. And solar basically stands for, face the other person squarely. You adopt an open posture. You lean towards the other person. You maintain an eye contact and try to be relaxed when you're paying attention. So this particular behavior, when you are in a meeting, when you are in a group, say for example discussion, or when you are having a conversation with a group of colleagues, the use of body language and this particular model, which is called the solar behavior, is used by a lot of psychologists in particular to try and decipher that whether you are able to fit within the environment to have an effective communication or not. Are you going to be sympathetic? Are you going to be friendly towards the people that you meet within the health and social care context or not? And sometimes when you have meetings or when you go to training or conferences, the trainer, who is also in most cases an expert psychologist and the person who is able to understand body language quite well, is able to pick out a few people from the training and have conversations, because he or she is able to clearly decipher if the person is open minded by looking at the posture, is able to understand whether the person is with him in the training and in the conversation because they're able to make an eye contact, and also if the person is actually relaxed, is actually disturbed, or is the person anxious or excited to be able to attend. So these kind of expressions the person is able to get a clue about from looking at the solar behaviors of the individual within that context. So when you work within the health and social care context, this is one of the most important things that you need to be able to understand and also be able to use by looking at the person from his or her body language. Is that okay?
Yeah.
There is a handout that I will also send you and also be uploaded onto the learner management system, which help you understand and decipher, body language in particular, to be able to, then pick up a conversation or strike a conversation depending on, the body language the person is able to exhibit. I don't know whether you sometimes noticed when you walk into a particular room and say, for example, you're walking into a room and there are 10 or 15 people who are having their own conversations. Sometimes you do find there are people which are standing with folded hands, they've crossed hands, or they have a bit of a very different posture in which they're having the conversation, and you're able to kind of strike a conversation with a person which kind of seems to be a bit open-minded or seems a bit inviting, rather than going to other groups or other people within the room wherein they kind of seem a bit obvious that they're too involved and they're not interested. So these are clues that you're able to pick up because your brain actually looks at the solar behavior of the individual and is able to pick up the body language and the gestures, and then it kind of makes you a bit more comfortable having a conversation with someone in the room rather than having someone different in that room. So those are things that I think you have to sometimes consider, and that is why the use of body language in particular is quite important when you look at the health and social care context, because it gives you very important clues before you even start a conversation in some cases with the person in that context. Is that okay?
Yeah.
Okay. I think coming to something towards the end, which is related to, appropriate language, tone, and pace. Have you ever noticed that, sometimes when you're speaking to somebody who's quite nervous and somebody who's quite, under a stress, they speak quite quickly. They kind of speak, the language or their speech kind of feels like as if they're talking to themselves, and it kind of is, mumbling, or it's not that clear or effective. Now, those are things that you are able to pick up from something which is called the tone and pace at which people are able to speak. You sometimes also see in the office settings or in the settings when you work is that sometimes your boss or your manager will call you in a loud voice, saying that they will suddenly out of the blue stand up and say, okay, can you see me for a moment? Can you see me for a minute, urgently? And that kind of gives you a subtle idea that there's something wrong, or there's something which has happened, that he's called me out of the blue. And that is something that you get a feeling of, because you're able to sense from the tone of voice, or the urgency in the tone of voice communicates to you to tell you that there is something which is which is either not expected, or it is something which requires immediate attention. So those are things which also are looked at as barriers. But how do you overcome this in terms of, when we are looking at barriers, is that you kind of pace yourself and also speak to the person by looking at doing a bit of an eye contact. You maintain a certain tone of voice, and you try and speak slowly. And in some cases, don't talk in jargons. Don't use acronyms or jargons, or make use of the words which are easily understood. A simple example that I would give you here is, if you go to, sometimes when you give your car out for service, right? And when you go to the, say, the dealership, and the service manager actually speaks to you, and he starts talking to you saying that, okay, we've looked at your car, we've done the servicing, but we found a number of problems. Now, up till this point, everything is understandable, and you expect the conversation to go well. But then suddenly you will find the service manager starts talking to you about, because there was a block in the oil filter, we had to actually change the oil filter. But we changed the oil filter, it led to another change in the piston, so he suddenly starts talking to you in a technical language. And for you, as a common man or as a layman, it does not start to make sense to you. So what you then do is, at some point in time, you maybe stop the person and you say, excuse me, could you tell me in plain simple English, what does that mean? Do you say that?
Yeah.
And in the case of health and social care context, you might have that conversation wherein the doctor is trying to explain to you, maybe the illness, or maybe some background about the illness, or a condition. And because of the lack of knowledge, or because it's something that you do not encounter on a daily basis in your day-to-day routine, you find that to be a bit of a barrier, because the message becomes too technical, or the message becomes too complex. And you ask the doctor to kind of simplify this. Can you simply make me understand, what does this mean? And those kind of conversations, when you have, are conversations that you have because you're trying to overcome a barrier by not using maybe jargons, or maybe too technical language which the patient or the person is not able to understand. So the use of appropriate language, obviously, and also the tone and the pace at which you speak, obviously kind of then helps you overcome a barrier, or maybe helps you, put your point across to the person in a much more clearer and effective way. This is something you must have noticed in our conversations quite a lot, clarifying or repeating.
Yeah.
Isn't it? Well, it turns out to be a bit of a monologue, but sometimes I have to keep asking you, are you able to hear me? Are you with me? Are you there? Do you see that?
Yeah.
So this is something which, you have to do, and these are lines which you have to kind of speak, so that it is a bit of reassurance, and there's also a bit of clarification saying that yes, the person that you're speaking to is able to understand and is able to then move along with you in the conversation in terms of his or her thoughts. In your case, so that I know your thoughts and you're able to follow this particular topic that I'm having a discussion with you about. So clarification or clarifying or repeating sometimes also helps to overcome the barriers. So if I say something quite quickly and I say that and I repeat that again, then that is to reinforce and also to reassure that by repeating the conversation or the sentence that I'm talking about is kind of, removing the barrier. If you've not been able to hear me, if you're not able to hear me well, or in some cases, if you've missed out on the meaning of what actually I'm trying to speak. Is that okay?
Yeah, that's fine.
Good stuff. So the term is parroting or repeating the points so that it helps you kind of do away with or overcome the barrier. Now, this table actually neatly summarizes, the benefits of effective communication, and in some cases you have to pick up, the jargon, which is for caseworkers or care workers, sorry, and for people who are within the health social care context in terms of providing services. So, effective communication helps carers to give and receive information that is relevant to individuals' care and well-being. You will be talking to a particular person to explain, the benefits of the medication or maybe, the information which is required for them to, come out of that illness or maybe get well. So some of these things we get to see, which are predominantly done in the case of patient-doctor relationship or, conversation as a practitioner or as a social caregiver to the patient, and you see these kind of usage of the methods of communication, whether it's verbal, whether it's non-verbal, whether it's body language, whether it's physical touch. You will find that this helps to communicate effectively in the health and social care context in particular for communication. Okay? Right, so this is where what I'm going to do is basically, this is where I'm going to stop. And what we have looked at in particular is, how, let's put it this way, in particular, what we've looked at is that we've looked at certain basic types of communication that we do, which is within the context of health and social care, whether it's between the patient and the care professionals, whether it's in between the practitioner and the care, worker. These kind of communications and the skills that you need are important because the communication in this context is slightly different when you have it in the context of business or maybe other, kind of situations. And there are certain elements of these communications that you have to bear in mind in order for that communication to be effective. Things like the tone of voice, things like empathy, and things like, for example, eye contact, sorry, which basically help make the communication quite effective and also shows your caring attitude and gestures toward when you're having these conversations with the patient or the customers. Is that okay? So any questions on today's session?
No. Just so it's today's session just covered 1.3.
This covers learning outcome 3, yes.
1.3 or the whole thing?
No, learning outcome 3. It covers the learning outcome 3 in particular, from 3.1 to 3.4.
Oh, okay.
Is that okay? And I'm going to primarily email you this, but in addition to that, I'm also going to send you a presentation, which is a couple of slides, which covers, some of these tasks and talks about, in particular, the related things that you need to know when you're having formal communications within the health and social care context.
Yeah. So
Is it okay?
when you're handing the assignments, is it all in? So all of the put on the deadline, all of the assignments from learning outcome 1, 2, 3, and 4 will be handed in at once in the end. Or
Good question. It's a good question. Now, this is something which is, I would suggest that you need to suit your style, because what we do get to see with most learners is that what they will do is once we finish the unit and they've done their bit of reading and understood and gone through the content in particular, most learners try and attempt the full assignment. But it's a good idea to start to look at after every session, if it is easy and convenient for you, to also start looking at doing these on a task-by-task basis. So if you've had 3 sessions on this particular unit, you might want to look at covering just learning outcome 1 to do a bit of a draft, then do learning outcome 2, and then look at learning outcome 3. So this will help you progressively build up your full assignment on a task-by-task basis. But depends on your comfort factor. I think some learners that are currently with us, they would primarily wait for the whole unit to be finished, and then what they would do is they will attempt the assignment and submit a draft to us for feedback.
Yeah, I prefer it as all, submitting it.
That's absolutely right.
So even if I do, after every session I do the assignment, I won't send it, I'll keep it, and then I'll collect the assignments, and then in the end check it properly, make sure that everything's there, that what I want there, and then send it all at once.
Yeah, that's absolutely fine with me. I don't, I think it is something, if it suits you, we are fine with that.
Okay.
Personally, if you ask me, I like it that way, because what tends to happen is that you sit, once you finish the unit, you have a good understanding of the overall objectives of what you need to cover in the assignment, and then I end up doing a draft, which I send in through the email for having some feedback on it, and the teacher is able to guide you that, okay, these are things which are correct, these are things which are okay, these are things you need to remove, and these are things that you need to add. So you get the inputs in terms of what is right and what is requiring changes, and then polish that draft up, add a bit of referencing, and obviously add the content, which is theory practice, and then finally make a submission. And that kind of works for me is because, personally speaking, I can maybe sit through for about 2 or 3 days and do that in parts, and then kind of reach a meaningful conclusion.
Okay.
Okay. Some learners do it that way, wherein I've covered a particular session with them today. So what they will do is they'll maybe do a bit more research, read the book, look at the presentation and the handout sent out, and start attending the tasks. So what they do is, because you're doing it on Word document, they keep saving it as 3.1, 3.2, or 2.1, 2.2, and then towards the end combine that into an assignment. So it's practically up to you in terms of which one is more comfortable and how you like to do it. There are no deadlines as far as the assignments are concerned, but what we tend to recommend to most learners is that we will try and give you an overview of the unit in about 4 to 6 weeks, depending on the number of sessions we are able to have. And once that is complete, because you have the whole unit which has been delivered and it's fresh in your mind, and obviously you just covered it, I think it's a good idea to basically attempt the assignment just after that, rather than leave it towards the end of the completion of the course, because then you tend to forget and you have a lot of units to cover. So it then becomes a big task, and also sometimes you tend to forget what's been delivered and what's been covered.
Yeah.
Is that okay?
Yeah, that's fine.
Good stuff. What are the plans for the best part of the day, which is left now at your end?
At mine?
Yeah, I'm just going to stop this recording for a second. Just give me 1 minute.